Greetings, welcome to Pharmacology and its clinical representation on the ocular system. My name is Dr. Rahn, and this video is dedicated to either give you the review you need after a rigorous amount of studying, or something that you just look at moments before the exam. Now for today's topic, we'll be discussing antipsychotics, so grab a pen and or popcorn, and let's see how much you've been studying. Now the use of antipsychotics is pretty much given in its name. It's there to treat those who, suffer from psychosis. Now, psychosis is defined a little bit more than just simply hallucinations. It is the act of believing in these hallucinations that gives its proper definition. There are many people who actually experience hallucinations that cannot be considered psychotic. For example, patients with Charles-Bonnet syndrome. Now, their ocular disorders such as macular degeneration or cataracts has them seeing very similar visual disturbances. However, the difference between them and, let's just say, someone with schizophrenia is that they actually know that these hallucinations are not real. And that ability to differentiate simple hallucinations from delusions most associated to psychosis is believed to take place in the dopaminergic pathway and its integrity of that. Now, the human brain consists of many dopaminergic pathways. However, for the sake of this video, we're going to discuss the four most commonly understood pathways. The first one is the mesolimbic pathway, which is pretty much known as the reward center. The mesocortical pathway, which is there for cognitive control, motivation, and emotion. The nigrostriatal pathway, associated majority for movement, and tubuloinfundibular pathway, which is there for prolactin inhibition. Now, there are 5 dopamine receptors in which these pathways carry out their intended purpose: D1, D2, D3, D4, and, you guessed it, D5. Now, each dopamine receptor has basically its own little thing. Like D1 is there for memory, attention, impulse control, regulation of renal function, and locomotion. But for the most part, we don't have to go into too much detail. Just know that the highest concentration of dopamine receptors happen to reside in D1 and D2, with D2 having an even stronger affinity to the antipsychotic medications in which they are associated with. Antipsychotic medications can now be broken into 2 categories: typical and atypical, typical being that of a first generation and atypical being that of second generation. Now, amongst the typical antipsychotic medications, there is a further categorization that needs to take place, and that is based on its potency. So you have high potency and you have low potency. High potency examples are fluorphenazine and haloperidol. There are a lot more, but we're just going to stick with those 2 for now. And they're very important because they have a strong affinity towards the dopamine receptor 2. Now, for the low potency medications, we have examples such as chlorpromazine, promethazine, and thyroidazine. Now, I went ahead and I marked these purple because they can actually be found on the National Boards of Optometry drug list. And since I am an optometrist, I like to put a little bit of favor for those who are in my field. Now, the low potency antipsychotic medications are pretty unique because they do not bind to the dopamine receptors exclusively. Actually, they have a bit of an affinity towards alpha-adrenergic, cholinergic, and histamine receptors as well. Now, the atypical antipsychotic medications such as clozapine and aripiprazole is going to have even less of an affinity towards D2 receptors, which means it's going to interact with the other receptors a little bit more readily. That on top of its involvement with the alpha-adrenergic and histamine receptors as well. So do keep that in mind when you're thinking of possible side effects. Now again, because I'm an optometrist, I'll only be going over the ocular side effects that are involved with antipsychotic medication. That being dry eye, increased IOP, mydriasis, induced myopia, diplopia, and so on and so forth. So why these ocular side effects? Well, we do know the cholinergic pathway involves lacrimation. So if that's inhibited, then, you have dry eyes. Increased IOP will have something to do with the adrenergic pathway, for it decreases aqueous production and increases UV scleral outflow. So if that's affected, then your ocular pressure is going to rise. Meiosis is also involving the cholinergic pathway. So again, if that's affected, then you will get mydriasis. And then induced myopia and diplopia will have to do with the accommodation portion of the cholinergic pathway. That gets affected, you're most likely going to have induced myopia and possibly diplopia as well. So how would something like this present itself in a real life situation? If you were aware that the patients are taking antipsychotic medication, then you could probably expect the exam, or at least the refraction portion of it all, to be a tad bit difficult. Patients can possibly not be able to see 20/20, and if they are able to see 20/20 one moment, then the next moment they can't, or they'll be fine that one day and then the next day come back and say how your prescription's completely off. Do expect that. And if you do happen to come across a patient that is having difficulties seeing what you're trying to have them see or getting them down to 20/20, then at that point you might want to let the doctor who prescribed the antipsychotic medication aware. So this concludes our review of antipsychotic medications. Do keep in mind, this is a review, and there are many more drugs that fall into this category, alongside with the side effects and different nuances on how these different drugs work and interact on the brain. Further studying is encouraged. However, if you're watching this video moments before the bell rings for you to enter the classroom and take your examination, well then I hope this video has served you well. Side note, this is my very first video, so if you found the information to be very helpful, go ahead and like and subscribe for more videos in the future. Also, if you have any other drugs that you'd like for me to go over or anything ocular related, I'll be more than happy to do that in the future as well. You guys have a nice day.